ABCs, what do you see? We talked about the primary assessment, but I'm going to try to give you a more focused map on a managing a patient. Now, there are many different type of focus maps. You can use a medical assessment format, and I think it actually works quite well as it keeps you organized. So this is a mnemonic. Basically, it's just a bunch of letters, and I'll go through A, B, C, D, E, F, G, H, I in the ABCs of what do you see. Now, again, it's just a format, and if you don't practice this, you won't be able to utilize it. And any assessment format will require you to actually use it when you go on calls. So let's get started. So the first step is to take airway, breathing, and circulation. But with that, I want you to also consider what are other things with A? What are other things that are with B? And what are other things that you could think about with C? Now, they're in the primary assessment. And yes, it's going to go above the basic skill set. Because in A, I want you to understand you're going to provide some type of airway support at a BLS level by using suction or an airway adjunct. But as you move forward, I want you to consider, as a paramedic would, when am I going to take this airway and would I need to use paralytics? And this is a range of different criteria that they've developed to make that point to try to take that airway. Now, as you go through B, you're looking at breathing rate, quality, and rhythm. Rise and fall of the chest, adventitious lung sounds, pulse oximetry. But we want to know more about the lung sounds, and we want to understand what's air trapping. Can they get air in, or is it hard for them to get the air out? And when we can use our end-tidal CO2 to help us to identify the different waveforms. And this is someone, like I said, a little outside of the scope of basic skill set. In circulation, we're not just looking at the rate, quality, and rhythm, or exsanguination, skin signs. We're looking at what is the rhythm on the monitor. Do we need electricity to terminate the lethal cardiac arrhythmia, or do we need to start pacing them? When do we initiate CPR? And when do we initiate those IVs and consider maintenance drips of vasopressors? Now, after you do your ABCs, it shouldn't take you more than 30 seconds. I want you to take a step back. I want you to see if you've treated those life threats and done them correctly. C also should stand for call for backup. And I said 30 seconds. I mean, you're not trying to deploy everything at once. You're just identifying what needs to be done. D, E, F, we went over disabilities, exposure. And I'm going to use F as another step for us to consider. And D, besides disability, would be now to delegate. Determine differentials. Do it yourself, but get started. E, besides gaining exposure to your patient, expose your patient. Effectively communicate with the team. Find those assessments. Find the life threats. Find the flags that don't belong on a normal patient. We all know the normal rates of breathing, pulse rates, blood pressures. Look for those flags. This is your 1 minute break. Then after 1 minute, take a step back. And are you doing it? Have you delegated it? Are you communicating with everyone? And are those life threats on your initial assessment corrected? If you are, great. Make sure those differentials are being thought of, and these are differential diagnoses. And let's move to the next step. G, H, and I. G is for go. You need to start gathering the information. That might be their identification cards, identification, health information, gather meds. Go ahead and get additional history and make sure that you're now doing your secondary exam, your head to toe. And don't forget to look inside now, inside this call, and identify those flags. Identify that primary assessment and identify that you have done or delegating those life threatening corrections. Patient needs to be managed. Okay, so now get those guys to assist with the extrication portion. And look at all those eyes, your interventions. Are your interventions working? Reevaluate your initial assessment. I know that was a long, drawn out slide. And again, it's probably going to take some time for you to understand. But in basic steps, it's doing your A, B, and C. Step back. Did you treat the life threats? D, E, and F. Are you doing something? Has it been delegated? Do you get exposure to the patient? Are you exposing the patient? Are you thinking about extrication? You need to either hand off reports or you need to go and get the gurney. You need to start handing over care and making sure that we're moving towards the ambulance because we need to go. We need to notify the hospital and we have to review if our initial assessment and our interventions are working. Each time we take a step after the first 3 series of letters to see if we have corrected and identified correctly what we needed to treat. It'll take steps. It doesn't automatically occur. And I know this is a different format. But try and do it. Practice it on paper. Consider verbalizing it so that you know what's A, B, and C. Step back. D, E, F. Step back. G, H, I. Step back. It may be also warranted that you do this on scenarios, off calls, so that you build up the muscle memory. Again, it's just a new format. Try it. It will be uncomfortable, but it will help. And if you put this into use, it will become a process that you can use.